The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. I am Ann Wong with the Illinois Chapter American Academy of Pediatrics, and I thank you for joining us for today's webinar, VFC Program Changes for Chip Vaccines. Today we are joined by the Illinois Department of Public Health, the Illinois Department of Healthcare and Family Services, and the Chicago Department of Public Health. We will be discussing the changes to the Child Health Insurance Program, CHIP, as it relates to the VFC. These changes are going into effect on October 1st of 2016. Before we begin, I would like to go over a few housekeeping items. Participant phone lines are muted. This webinar is being recorded. If you have any questions for our speakers during the presentation, please enter them into the question box on your control panel for the webinar on the right-hand side of your screen, and we will answer them at the end after all three presenters have spoken. When you are writing your question, please specify whether it is directed towards IDPH, HFS, or CDPH. This will help us streamline getting the questions answered in the most appropriate way possible. Please join me now in welcoming Virginia Cook from the Illinois Department of Public Health. Okay, Virginia, you have control of the screen right now.
Thank you very much, and thank you all for joining us for this webinar today. As she said, I'm Virginia Cook, standing in for Linda Kaysbire, who's unable to join us today. Here is the mission of IDPH. This presentation is a collaborative response from the Chicago Department of Public Health, the Department of Healthcare and Family Services, and the Illinois Department of Public Health. The purpose of this webinar is to review the VFC program changes to CHIP memo dated August 22nd, 2016. We will have a presentation on CHIP, All Kids, Title 21, reimbursement, and MEDI, then review next steps. Effective October 1st, 2016, the Illinois and Chicago VFC programs will no longer provide vaccines to providers for administration to children with Title 19 insurance, which is the state's Child Health Insurance Program, or CHIP. The Department of Healthcare and Family Services refers to this as Title 21 or state-funded insurance. Children through the age of 18 until the date of their 19th birthday who have traditional Medicaid coverage are still VFC eligible. This Medicaid coverage is also referred to as Title 19. The CDC recommended that the VFC program discontinue purchasing and providing VFC vaccines to VFC providers for administration to CHIP children. This decision was made by the Director of IDPH and the Director of the Department of Healthcare and Family Services, or HFS, after months of discussion. The CDC does not require that VFC programs provide vaccines to children with CHIP or All Kids insurance coverage. The federal vaccine year starts on October 21st, 2016, and the change must start at the beginning of the vaccine year. Neither the VFC program nor VFC eligibility has changed. The only change is that vaccines for Title 21 CHIP patients will no longer be supplied through the VFC program, and providers will need to seek reimbursement from HFS. CHIP is the state's Children's Health Insurance Program, or CHIP. HFS refers to this as Title 21 or state-funded. CHIP provides health insurance to children and families with incomes that are above the Medicaid Medicaid eligibility, but without access to private insurance. Children with CHIP insurance are not VFC eligible because they're insured, just as other children with private insurance. A child will not have both Medicaid Title 19 and CHIP or Title 21 on the date of service. A child will have one or the other. All VFC providers are required to screen children for VFC eligibility at each immunization encounter. This is a partial picture of the VFC patient eligibility screening record available in iCare. VFC providers may either use this form or a similar paper-based or electronic form that captures the same reporting elements. Medicaid and CHIP are different and should be marked accordingly when screening patients for VFC eligibility. HFS requires providers to check the eligibility status in Medi before administering vaccines or other services or risk non-payment. Here's a chart showing the different eligibility types through the Department of Healthcare and Family Services. HFS, commonly referred to as Medicaid, and what kind of vaccines should be used. Each agency refers to the programs differently. This chart shows all of the different names for the program. Medicaid or Title 19 patients who are age 18 or until the day before their 19th birthday are VFC eligible. VFC vaccines should be administered and providers should bill HFS or the managed care organization for the administration fee. Medicaid or Title 19 patients who are 19 years or older are not VFC eligible. Privately purchased vaccines must be administered and bill HFS or the managed care organization for the vaccines and administration. CHIP patients, either Title 21 or state-funded, may not receive VFC vaccines after October 1st, 2016. Providers should administer their privately purchased vaccines and bill HFS or the managed care organization for the vaccines and administration. Other eligibility notes: any patient 19 years of age or older is not eligible for VFC vaccines. If the patient is 18 years of age or younger and have private insurance that covers all vaccines, the patient is fully insured and not VFC eligible. If the patient is 18 years of age or younger and the private insurance does not cover vaccines or does not cover all ACIP recommended vaccines, the patient is underinsured and VFC eligible for the vaccines not covered by insurance. However, the patient would need to go to a VFC enrolled federally qualified health center, a rural health center, clinic, or a local health department that has been deputized by NFQHC. The VFC eligibility decision tree will be updated and distributed soon. We will now have a frequently asked questions document posted in iCare, but wanted to cover some of the questions now. Question: how can we run a report in iCare to show the number of CHIP children we have served? The answer is, if your clinic has been using the VFC status of V06 S-CHIP plan for your CHIP patients, your enrollment forms patient population section will show the number of CHIP children you have entered into iCare. Note, however, children with CHIP should have their VFC eligibility status in iCare documented as V22 CHIP. V06 will no longer appear in iCare after September 8, 2016. CDC has replaced the code with V22. A memo describing the changes to the VFC eligibility code is available in iCare. Here's an example from the VFC enrollment form in iCare showing a sample clinic's number of CHIP children. The patient records were entered or transmitted to iCare with the patient's VFC eligibility status marked as V06, VFC eligible, S-CHIP plan, for patient records prior to September 8, 2016, and V22 CHIP after. Question: if a provider is not able to purchase or has not received privately purchased vaccine for CHIP children by October 1st, 2016, can they use VFC vaccines and repay VFC later? Answer: no. The Illinois and Chicago VFC programs do not allow borrowing of VFC vaccines. Providers should ensure that they have an adequately privately purchased vaccine supply or reschedule the patients. If VFC vaccines are administered inappropriately on any patient not VFC eligible, including CHIP patients, the provider will be required to replace the misused VFC vaccines with privately purchased vaccine. It's very important that providers screen the child for VFC eligibility before administering vaccines. Question: if a provider administers privately purchased vaccines on a child they believe has CHIP or all kids coverage, but finds out later through billing that the child has Medicaid or Title 19, can the provider replace their private vaccines with VFC vaccines? Answer: no. The Illinois and Chicago VFC programs do not allow borrowing of VFC vaccines to replace privately purchased stock used inappropriately on insured children. That will include CHIP children on or after October 1st, 2016. Question: are VFC providers required to serve CHIP patients? Answer: the VFC programs do not require any VFC enrolled provider to serve fully insured patients, which would include CHIP. We do strongly encourage providers to consider having a supply of privately purchased vaccines for these populations so the children can be appropriately immunized. If you do plan to continue to serve children with CHIP insurance, you will need to have privately purchased vaccines in stock, as you will no longer be able to use VFC vaccines on or after October 1st, 2016. Here is our contact information for both Illinois and Chicago VFC programs if you have any additional information. Thank you.
Thank you so much for that, Virginia. We are now going to introduce Kathy Bertolino from Healthcare and Family Services.
Hi. Oh, there we go.
Yep. Okay, Kathy. Let's see your
Okay. Okay, effective October 1st, 2016, VFC vaccines are limited to Title 19 children. This is from birth through age 18. All other participants must receive their vaccine to the provider's private stock. This is for children that are state-funded or Title 21. This is also referred to as CHIP, and also for adults ages 19 and up. Please be aware that children who have all kids can either be Title 19, Title 21, or state-funded. VFC stock can still be used for an all-kids child as long as they are Title 19. Providers need to verify eligibility prior to services being rendered. Do not do a date range when checking eligibility. You should only be checking for the date that services will be rendered. You need to verify if the participant is Title 19 or Title 21. And there's only two ways to verify this when checking eligibility. You may verify this information by using either Medi or the 270-271 eligibility. If you use the automated voice response system, you will not receive the title information for participants unless Medi is down. The hotline representatives will not give title information if Medi is available for your use. If you're not registered in Medi, you really need to get registered now, since you only have the two options to verify the title information. Please don't wait to the very last minute to get registered. I would suggest going, if you're not registered in Medi, I suggest you go out and get registered now so you can get familiar with it prior to October 1st. Again, here we're showing that if the participant is Title 19, you would use VFC stock for your vaccines. If the participant is state-funded or Title 21, also known as CHIP, you would use private stock for vaccines. On these next few slides, we're going to be showing you examples of eligibility. You'll need to look at the special information to see if the participant is Title 19, 21, or state-funded. Children with all kids can be either of these. So on these next few slides, we have examples on how to read eligibility when using the Medi system. Again, when checking eligibility, you should only check for the date that services will be rendered. You should not do a date range. It can give you incorrect information. An example would be if you're checking the participant's eligibility for the entire month and the patient was not eligible on the first part of the month, but they were on the second half, it could show them they were eligible for the whole month when they were actually not. So only check for your specific date of service. On this slide, we show you that on date of service 5/1 of 16, the participant has all kids. And this is under the case type. We show the services that are covered for this participant. You know, you have examples of therapy, pediatric, urgent care, podiatry, etc. Under special information, we show that this is a Title 19 plan. We also show you that they're in a managed care organization. We give you the name of that plan along with their contact information. Since this participant is a Title 19 participant, you would use the VFC stock for vaccines. In this example, though, you would need to bill the MCO for your reimbursement. I do also want to point out here that that plan code 19 under that MCO, that is not title information. That just tells us who this plan is. So title information, you still need to look at special information. Even if they have an MCO, do not look at plan code. This next example shows a date of service of 6/1/16, and they're all kids, premium level 2. We show that services that are covered for this participant also. This time we also have co-pays for each service. And under special information, we show this is a state-funded plan. Providers would need to use their private stock for vaccinations. I would also like to point out that this participant has a primary insurance. And this is where you'll see this information at. Besides giving you the name of the primary insurance, we also give you a 3-digit TPL code that you would use when billing the department. And that is under source code. So that source code 006, that's the 3-digit TPL code that we use when billing the department. This example shows a date span of 4/30/16 through 5/1/16. For the dates of service of 4/30/16, the case type shows them as being all kids premium level 2. I'm sorry, premium level 1. And under special information, it's a Title 21 plan. For the date of service of 5/1/16, the case type is all kids Medicaid, and this is a Title 19 plan. So if the vaccine was administered on 4/30/16, then this would come out of the provider's private stock. If the vaccine was administered on 5/1/16, then you would use VFC stock. This is an example of two different case types for the same date of service. For date of service 7/20/16, we show that the case type is all kids Medicaid eligible. Again, we show the services that are covered, and this is a Title 19 plan. We also show another case type, which is DHS Social Services, and under the special information, it shows them as being state funded. DHS Social Services does not cover medical services, but since this participant is a Medicaid eligibility under Title 19, you would use the VFC stock for vaccination. I'd also like to point out that all of these examples so far that I've shown you, the case type shows all of them as being all kids, but they're either Title 19, Title 21, or state funded. All Kids is a program with HFS. You will see All Kids as a case type, but still look at the special information to determine what title they are in. This is just an example of a participant that only has DHS Social Services. When checking eligibility, if the only eligibility that you see is DHS Social Services, then the participant does not have medical coverage. As you can see, it states that this client is eligible for limited medical benefits. This eligibility does not provide coverage for vaccines or other medical services through HFS. On the example before this one, the participant had both medical and DHS, so they would be covered for medical services. And the only reason we're showing you this example is because you're going to see this at times. When you go to check eligibility, sometimes this will be all you see when checking eligibility. So when checking eligibility, if this is all you see, patient is not eligible for coverage through HFS. You will need to investigate if the participant has insurance from another source, but HFS will not reimburse you for services rendered when the patient only has DHS Social Services. Providers who utilize a vendor for eligibility should contact their vendor to determine how title information will be displayed. And vendors can refer to the 270-271 companion guide for this. For VFC billing, vaccines are free to providers from the VFC stock. This is for a Title 19 child from birth through 18. You will need to bill the department for the vaccination that was administered. You're only being reimbursed for the administration fee for administering the vaccine. For these rates, refer to the practitioner fee schedule under the unit price column. Encounter rate clinics should include the vaccines on their claim as a detail code. You will not bill with a modifier when using VFC stock. For private stock billing, providers need to use vaccine from the private stock for children that are 18 and under and Title 21 or state funded, and for anyone that is 19 and older. You need to bill the department for the vaccination that was administered. Encounter rate clinics may bill for private stock vaccine fee for service. For rates regarding billing for private stock, please refer to the practitioner fee schedule, and this will be under the state max column. These rates will also be included under the frequently asked questions. For encounter clinic billing. So for encounter clinics, when using VFC stock, you're going to bill the way you always have billed the department. So for a face-to-face visit with practitioner, you will bill using the T1015 code along with your detail codes. You will be reimbursed your encounter rate. If there is not a face-to-face visit with a practitioner, you will bill using that S5190 code along with the detail codes. This is for reporting purposes only. You will not be reimbursed your encounter rate. So this is the way you've always done it. So now for encounter clinics when billing private stock, and this is for Title 21 or state-funded children. The clinic can bill us fee for service. You would bill it, actually you would bill us like you would when you're billing it for an IUD. You'd bill it on two separate claims. So for a face-to-face visit with a practitioner, the first claim will be for your encounter. You will bill the T1015 code along with the visit code as your detail code. The second claim will be fee for service. For the fee for service claim, you're only going to bill the vaccines that administered, but this time you have to bill with a GB modifier. and that modifier needs to be with each vaccine that you're billing. Do not include the T1015 code on this claim. So you're only going to see the vaccines, but you will use a GB modifier now. If the child by chance was only there just to receive their vaccines, there was not a face-to-face visit with a practitioner, you would still bill the vaccine fee for service along with that GB modifier. You would not use a T1015 code or the S5190 code. So, and you would not bill a separate, you do not need to bill a separate claim, just bill the vaccines that were administered. So for the administration, or for the reimbursement of these vaccines, these will be on the practitioner fee schedule, and this will be under the state max column. So the department right now is currently working on the rates. We're finalizing the rates and hope to have them available soon. So, and these rates will be posted on the practitioner fee schedule, and it should be, and the new fee schedule should be coming out shortly. But prior to the fee schedule being updated, once these rates are finalized, they will be included on the website on the non-institutional providers page. They will be under vaccines and also their frequently asked questions and answers. And they're working as quick as possible, so we're finalizing those rates, so please watch out for those rates to be posted. For participants that are enrolled in an MCO, providers need to contact the managed care organization regarding billing issues. As for the reimbursement rate, you need to contact that plan regarding your reimbursement. The department is almost always the payer of last resort. One of the reasons that you can bill the department directly when there's a commercial insurance primary is when it is for a preventative service. You can bill the department directly instead of billing the primary insurance first. When a participant has a commercial insurance as primary and is Title 21 or state funded, you need to use private stock. When a participant has a commercial insurance as primary and is Title 19, you need to choose whether to use your private stock and bill that primary insurance or to use VFC stock and bill the department for the administration of that vaccine. Please be aware, though, if you do choose to bill the primary insurance and they reject your claim or even apply everything to deductible, you can still bill the department, but now you're only going to be reimbursed for the administration of the vaccine. You will not get the full amount. I've also had some questions of what TPL stands for. It stands for third party liability. So whenever somebody refers to TPL, you understand what that's for. Per the American Recovery and Reinvestment Act, claims must be paid within 30 days of receipt. And this is for most providers. On our website, under the non-institutional providers resources, we will be posting the frequently asked questions, the VFC webinar, and the private stock vaccine rates as soon as possible. Right now, you can already find the previously conducted webinars, MEDI instructions, vaccine billing instructions. We have timely filing instructions, timely filing questions and answers, and along with participant liability and participant copays out there. We provided that link for you. We've also provided the link for the HFS Medical Providers homepage for in case you're needing that. I do want to point out that at the end of the webinar, Edna will be going over some previously asked questions from providers. And this wraps up the presentation from HFS. Thank you.
Okay, thank you, Kathy. We are now going to have Marcia Levin from the Chicago Department of Public Health speak.
Oh.
Hi, Marcia.
Hi, everyone. I'm Marcia Levin from the Chicago Department of Public Health. I'm going to review very briefly what we learned and tell you about your next steps. Oops, that's not what I want to do. Okay. Oh, I'm sorry. Yes, slideshow. Here we go. Okay, so we've heard a lot of terms, and I know that it may sound a little muddled to all of you. We heard the term all kids, we heard CHIP, we heard Title 21, we also heard Title 19. But I want to specify that Title 21 is our primary interest today. That is the Children's Health Insurance Program in Illinois. It is a health insurance program, and we all know that children with insurance are not VFC eligible. And this is a little challenging because in the past we've sort of treated them like Medicaid kids, but we are not. We are no longer going to treat them this way. Okay, so what we wanted to talk about, and I know Kathy spoke about it, and you've heard references to the MEDI system. The MEDI system was something that you were encouraged to participate in back in 2014. However, we understand that many of the doctor's offices that we work with may not have actually complied with that requirement. We want you to get into the register right away. You can, in addition to having your clerks who may be looking up their information when they're registering, you can have 2 administrators who also have access and can be the fallback if someone is not there that day. Everybody should be trained to use the MEDI system and to be able to discern, as Kathy Bertolino's slide showed, what is a Medicaid eligible child who remains VFC 100% versus a child who is Title 21 or CHIP, or what we used to refer to as the All Kids Health Insurance Program. Kathy did mention the automated voice response system. It does not include special information, but my understanding is that you can work through a few prompts and speak directly with someone who can give you that information should there be a problem in you getting through to MEDI. Here's how you register for the MEDI system. If you need help with the registration, you can contact the help desk. And again, as Kathy pointed out to us, the special information at the bottom of the MEDI screen is really where you're going to see this Title 19, which is Medicaid, and Title 21, which is the CHIP program. If you are using an EMR, you should work with your vendor to understand how this change will impact your eligibility fields. Eligibility should include a CHIP designation. However, not VFC eligible will be acceptable. And definitely educate all your staff on how CHIP eligibility should be documented in your facility beginning October 1st of this year. Virginia mentioned the change in the eligibility code from V06 to V22, and you should have already seen this code change already in your iCare. But please make sure that you're using the codes correctly, because it will help you for future purposes in identifying the amount of CHIP kids you have in your clinic. Make sure also too that your staff is drawing down from the appropriate vaccine inventory, which will be your private vaccine inventory versus your VFC. Right now we want you to assess your current commercial stock inventory and order your private stock vaccines appropriately. Do it now. It's going to take some time to get it in your office. Make sure that all of your private stock is separated from your VFC stock and it's labeled so that your staff is using the correct stock. Make sure that you're maintaining an adequate inventory of both stocks to prevent the need for any borrowing, which is not allowed by Chicago or Illinois VFC programs. And we did give you, or on IDPH, they gave you a slide with our contact information, and that is, again, Chicago VFC at cityofchicago.org if you have any additional questions. But now I'm going to turn it back over to HFS, and they're going to review some of the commonly asked questions.
Okay, thank you, Marcia. I'm going to go ahead and turn it back over to HFS.
Hi, my name is Edna Kanyas, and I'm a manager at the non-institutional provider billing area. We basically work with all providers except hospitals and long-term care. We received about 300 questions, and I want to go over some of the questions, not all 300. You're lucky. And we received questions regarding reimbursement, fee-for-service questions, as well as encounter rate questions. And like Kathy said, we are getting ready to post the rates. We're just finalizing those for the fee-for-service providers. For the encounter rate clinics, we did change the previous decision, and encounter rate clinics are going to be reimbursed fee-for-service for their non-VFC vaccinations for Title 19, or excuse me, for Title 21 of the state-funded folks. So hopefully that will resolve a lot of your anxiety. I know we've received a lot of questions. We've also received questions regarding the MEDI system, regarding how to read MEDI, its availability, as well as how to access it. We currently have on the non-institutional provider website, we have a specific link for the vaccine for children providers, and right now we have a link on how to get registered. It provides very detailed information. I recommend that if you're not registered to go onto that website to just to figure out how to register. We are also going to post a link on how to read MEDI, just like Kathy went through, but we want that easily available for you. So that is not ready, but it should be out soon. We also have the current fee-for-service billing instructions. We do not have the encounter rate billing instructions, but we are working on those, and we should have those posted as well. And as far as MEDI is concerned, we received a lot of questions regarding it being down. And our research found that the MEDI system is available, and I was referred to the MEDI homepage. The MEDI homepage has information right on it stating that when MEDI is up, or when it doesn't have anything when MEDI's up, but if MEDI is down, you'll be able to access that information on the MEDI home site. Right now, if you read it, it states that if a message is not displayed stating that MEDI is not available, you probably have another issue. It could be your Java system. It must be Java BU 101. And I would refer you to the MEDI homepage for updated information because Java is routinely updated. HFS does not control Java. There may be some of you who say, like, no kidding, but we did receive that question. Also, if a password is over a year old, you may be prompted to change your password. For Illinois users, use the Forget Password button. For out-of-state, you're going to have to call. The MEDI homepage also has information regarding which web browser to use and which ones not to use. So I recommend that you go to the MEDI homepage, and MEDI is, again, usually available. In the very limited situations when MEDI is not available, we do have our provider hotline. That should only be accessed when, again, when MEDI is not available and as a last resort. You will have to call the automated voice response system and bypass all the prompts and reach a hotline operator. In addition to MEDI, we receive general billing questions, and we are going to post that on the NIPS page. We received information and questions regarding managed care entities, and we will not answer managed care questions. That's a contract between the managed care entity and you. They have been notified. We had questions regarding whether or not clients would be notified. We are not notifying the clients because there is not a change in their benefits. The change affects a provider and not the client if this is basically invisible to the client. And I don't have, I think I covered just the general topics. Questions regarding billing, again, Kathy referred you to the NIPS billing page. We also received a lot of questions whether you could balance bill a patient, whether you could charge a copayment. Copayments should never be billed for preventative visits. And if you go to the copayment appendix, you will find the exact procedure codes in the situations in which you will charge a copayment. Other than that, you should never charge a department participant for anything other than the Medicaid copayment amounts if you agree to accept our payment as payment in full. So, Ann, I think I've gone over what I wanted to go over, and I hope that I did answer most of the questions. Also, want to let you know, providers, that we are here to help you. We know that it's been hard for you to adjust because it's been such a short time period that we've had to implement this, but we are working with providers, and we do appreciate your feedback. Thank you.
Okay, thank you so much, Edna. I hope that everybody found that information very helpful. We are now going to move on to the general question and answer session, but before we did get started on that, just briefly browsing it, I did notice a lot of questions about whether or not we are going to be receiving copies of the slides and a recording, and I just want to let everybody know that just like with all of the webinars that ICAP hosts and facilitates, everybody gets a copy in their email of the PowerPoint slides, as well as a link to view the recording of the webinar. So now we are going to move into our question and answer session. And one question, I mean, there are a lot, but let's start with to check with Medi eligibility, do we check with the patient's 9-digit ID number?
When checking eligibility, you should use the 9-digit recipient number. You'll have to be registered. And just in addition to that, we will be going over Medi and have a webinar regarding Medi soon.
Okay. And another question is, are health departments still offering vaccines to CHIP then?
I'm going to defer to DPH.
So this is, Virginia, did you want to address that?
Please go ahead, Marcia.
Okay.
So Marcia.
Okay, yes. All right, so here is our current situation. We do plan to serve our CHIP children, but we cannot speak universally for all the health departments across the state. I do think that every health department will be evaluating whether, first of all, whether there's a budget with which to purchase commercial stock, and then they'll have to make a decision about going forward from that point. Up till now, in the local health departments, we have never served an insured group of children. We traditionally serve some Medicaid kids, and larger numbers perhaps of children who have no insurance or who are in between insurances. So this is something that has to be evaluated by each local health department, and we can't address it here.
This is Dr. Frashone with Chicago Department of Public Health. We do not currently have a mechanism to purchase private vaccine to vaccinate this group of children, but that may change moving forward in the future. So currently in the city of Chicago, CHIP children could not be referred to our clinics for vaccine.
Okay, and where else can CHIP patients get their vaccines besides doctors' offices?
I think that's a pretty broad question in general. We do know that we work with a number of school-based health centers. A lot of those school-based health centers are affiliated as federally qualified health centers. So I would assume that many kids can continue to be served by these entities. And we don't know at this time what if providers who are not federally qualified healthcare or rural health centers will continue to serve children who are in Title 21. This is, again, an evaluation that each provider will make based on the number of children that they see and the level of their business. So at this time, we have no mechanism to say these children can be referred to any provider until each of these providers, each or all of the VFC providers in Illinois have a chance to evaluate whether or not they're going to continue to see Title 21 children in their office.
Okay, another question is, can we use VFC stock for CHIP patients until October 1st of 2016?
Yes, please use our stock until October 1st.
Okay, and then Lynn says some babies do not have eligibility when we see them. How do we know which stock to use?
If a newborn mother is on Title 19, the baby will also be Title 19. If a newborn mom is Title 21, we do not know. It's based, we have to wait. Also, a newborn can be added to a case through the new IES system, and we should be able to get some more information. I was not, when I researched that question, I still was not clear on the answer, so I don't want to provide too much information, but that will definitely be, that is definitely a question. It will be answered on the frequently asked questions.
Okay, and another question is about American Indian children. Are they still covered by VFC regardless of insurance type?
This is Virginia Cook, and the answer is yes. Alaskan Native and American Indians still are covered under VFC.
Okay, if you have a CHIP patient and use private vaccine, do you bill the vaccine separate from the visit?
Only if it's an encounter rate clinic who bills with the T1015 code. If you are not an encounter rate clinic, and those include federally qualified health centers, rural health centers, and encounter rate clinics. So if you're not an encounter rate clinic billing under the T1015, you do not need to bill the vaccine separately from the visit. Only encounter rate clinics need to do that.
And we will be posting encounter rate specific billing instructions. They're not listed on the website yet, but we will. We're working on those right now.
Okay, how long does it take to get a Medi login?
If you are a Illinois resident with a driver's license, the whole process should take about 30 minutes.
Should we bill HFS if MCO didn't cover some vaccines?
If a client is enrolled in a managed care organization, that managed care organization is responsible for that participant's care and cannot be billed, nothing can be billed to HFS.
Okay, this question is for HFS. If they only have social service coverage and they have no other insurance, would they receive VFC underinsured?
If the participant has DHS social services only, they are not insured through our department. You may want to check to see if they have a third-party liability or commercial insurance, but for department program purposes, they are not insured. And then from what I understand, I don't want to answer DPH's question, but non-insured children receive the VFC vaccine.
And that's correct, Edna. Children who have no health insurance, they're self-pay, they have no EPL or third-party liability, they are considered uninsured and they are 100% VFC eligible.
But to clarify, if you're seeing DHS social services eligibility only on the Medi screen, that does not mean they don't have some other insurance. So please do not assume then that they are uninsured.
Thank
you. Okay, so I've gotten a couple of questions about this, so I'm just going to try and paraphrase it, but it looks like some of the providers, when they check on Medi, siblings have a different title status. How can this be explained?
I am not a caseworker, so eligibility is different, is a whole different program, and it may be that they have, well, I'm not going to answer that. I can answer that in the frequently asked questions rather than give an incorrect answer.
It is a possibility. You just need to make sure you're checking eligibility for the patient, the specific patient you're seeing.
Okay, someone wants to know if you will be releasing a statement that we can give to parents to read explaining these changes. I feel they will question us since they have always received the vaccines.
The HFS is not sending out participant information. Again, it should really be invisible to the participant, and it's probably not, I assume, because you are sending them somewhere else for their non-VFC vaccinations. But we are not going to notify participants, and the department does encourage you to immunize the children who are on your panel. If you are a PCP, you should, let's see, you should either provide the vaccination or coordinate the primary health care for the participant on your panel. We do encourage all providers to accept and render immunization care to your participants. We hope that our policies and our procedures were made to minimize the disruption that's happening to you. And I hope that once we post the reimbursement rates that you'll change that decision.
Okay. Will HFS pay a fee for private stock vaccine if the client turns out to be Medicaid and not CHIP?
If you use a, no, we will not. Eligibility, you won't, when you bill, our system will pay based on the client's eligibility. It really doesn't matter which vaccine you use. that's not what we're going to consider. We're going to consider the client's eligibility, whether it's Title 19, then we'll pay the $6.40, and if they're Title 21 or state funded, then we'll pay the fee-for-service reimbursement rate on the fee schedule.
Someone wants to know when the Medi-Utila conference will be.
We have not determined a date, but hopefully it'll be within this week or next.
Okay. How far out can you check for eligibility?
I would recommend that you check eligibility the day the client presents at your office or the day before. Eligibility usually changes month to month. If it's going to change, it's going to happen at the end of the month, but that does not guarantee. That's not guaranteed. So I recommend that you check eligibility either the day the client presents at your office or the day prior.
Do the managed care Medicaid plans still use VFC vaccine?
The managed care organizations will, for Title 19, you'll use VFC. For Title 21 and state funded, you'll use your private stock vaccines. The only thing that's different is if a client is on a managed care plan, you're going to bill the managed care plan, and if they're on the traditional, on a traditional department program, then you're going to bill us, HFS.
Okay. Someone wants to know if they can purchase private vaccines at the CDC prices to immunize CHIP patients.
The answer to that question is no. The only people who purchase off of the federal contract are federal grantees and other persons associated with the federal government.
Okay, so it looks like we are wrapping up on our time. There are definitely still many more questions that are being asked than we can answer in the few minutes that we have left. So I think the best plan to go ahead right now is to try and put together a frequently asked question list like we've been doing in the past, and then IDPH and CDPH and HFS will try and work to get those questions answered as soon as possible. Are there any more comments from CDPH, IDPH, or HFS right now?
No, thank you.
No, thank you.
Okay, wonderful. So once again, thanks to everyone for joining us on today's webinar. I know that this is a really confusing time, so we'll try our best to work together and get everybody's questions answered in a timely manner. Thank you again. Have a great afternoon, everyone.
Thank you.
All right.